Hi everybody, I'm Erin, and I'm a board-certified pediatrician. And today we're going to talk about what to do if your child's COVID test comes back positive. We're going to talk about what to look for, how to know if your child needs to be seen by a doctor, and how to keep the rest of the family safe. And we're also going to review what supplements are actually evidence-based. So if any of this sounds like information you need now, or information you're worried you might need in the future, then you've come to the right place. So take a deep breath and don't worry, because I gotcha, and we're going to get through this. So firstly, and most importantly, don't panic. And I say that not because this isn't a big deal, but because if you lose your mind, it's not going to do you or your child any good. And that's why I'm going to give you a couple of reasons why things are going to be okay first, so we can all de-escalate before we dig into the concrete stuff. That said, if you're one of those chill people that really don't need this part, feel free to do just a little double tap right over here, and it'll probably scrub ahead 10 seconds. Or you can just click forward to the next chapter in the description below. So let's start by taking a deep breath and remembering that all of your parenting instincts, those still apply here. Those instincts are valuable, and you should continue to trust them, pandemic or no pandemic, because nobody knows your child better than you do. So if your kid is acting fine, then they're probably fine. But if your spidey senses are tingling and you feel like there's just something not quite right about them, then that's useful information, and we need to add that to the list of data that we're going to keep track of throughout this isolation period. Yeah, but here's why you shouldn't do that. There are a couple of big reasons why kids tend to do well with this particular infection. Firstly, in the first week or two of an infection, it's the innate immune system rather than the adaptive immune system that is functioning to control the infection. If someone is going to get really sick with COVID-19, it usually doesn't start to get bad until the second week. And it's the activity of the innate immune system that dictates whether you fight off the infection with mild or no symptoms, or if you get really sick. And the innate immune system is strongest when you're young, and it gets progressively weaker as you get older. So infants, toddlers, and young children are the most equipped to fight off this infection before it escalates. As an aside, as you get older, the adaptive immune system gets better, but your innate immune system isn't as good. The second reason is the virus uses a cell surface receptor called the ACE2 receptor to bind to in order to get into the cells. And you have relatively fewer of these receptors on the surface of your cells when you're young, and you get more and more of them as you get older. So this means that the younger you are, the more difficult it is for the virus to not only get into your cells in the first place, but if it does get in and replicates, it's harder for those replicated viruses that are released into the rest of your body to get access to your other cells, because every time it accesses another cell, it needs to find another ACE2 receptor on the surface of that cell. It's harder for the virus to get in, and it's harder for the virus to spread inside your body when you're young. Kids do well with this infection because of their physiology. So now that we know that probably everything's going to be fine, let's talk about what to look for to make sure that everything actually is fine. Firstly, we need to know when to pay the closest attention. When in the course of the infection is it most likely to be dangerous? So we know that the incubation period is about 2 to 5 days long. So after exposure, it takes about 2 to 5 days before we would expect someone to start to be symptomatic. After that, if they do become symptomatic, the first week looks like a cold, or maybe a really bad cold. If you're going to get more sick, we would expect that to happen between days 7 to 10. That's when they'd be at the highest risk of worsening and needing hospitalization or breathing support. So that's when we're going to watch people more closely. What can you do to monitor them during that time? So for COVID-19, it's actually more relevant than with other viral illnesses that we monitor your blood oxygen level. Getting an over-the-counter pulse oximeter that measures your SpO2 can be beneficial for this particular infection because some people can breathe comfortably and still have a low oxygen level in their blood, which is unusual for most infections. Typically, when your blood oxygen level decreases, we would expect you to feel short of breath and to work to try to bring your oxygen level back up. So this is a finding that's fairly specific for this particular virus. So, okay, you get a pulse ox. What are you looking for? We're generally hoping that your oxygen level will be above 93%. Now, it'll bounce around a lot and go up and down from one second to the next, and that's okay. Now, if you're at altitude where the air's a little thin, then you may hang out at 89%, and that's okay. If you're not sure, just check the other people in the house to get a baseline. So what you want to do is make sure that you or your child's hands are warm, and place the pulse oximeter over the tip of your finger. And then hold that finger below the level of your heart for 10 seconds. Just try not to move as much as is realistic with a toddler, and take the reading, after the number has roughly stabilized. Pro tip, if you do get a pulse oximeter, one important detail is that because of the way it works, if you're wearing pigmented nail polish, it won't give you an accurate reading. So what if you don't have a pulse oximeter? That's fine. With older kids or adults, they can report a sense of shortness of breath or decreased exercise tolerance, having to pause when they're going up the stairs, or stopping when they're running around and playing to catch their breath, Infants and toddlers can't necessarily tell you that, but we can watch for an increase in what we call their work of breathing. So when people are having trouble breathing, they start to use extra muscles to try to force air in and out of their lungs. People of any age will often start to breathe faster because if your lungs are less effective, you can compensate for that by taking more breaths, at least for a while. So what are the signs of an increase in a child's work of breathing? Infants in particular will bob their heads. They'll bob backwards when they're breathing in and forwards when they're breathing out. They may also start to grunt with each expiration, and this partially closes their vocal cords, which slows the outflow of air and increases the pressure inside their lungs. Another thing that we look for is called retractions. So depending on your age, we may look for retractions beneath your rib cage, or between your ribs, or above your collarbones, or just above your sternum. In really young infants who are mostly cartilage, it might look like the entire rib cage is flexing inward. If you look really carefully at this video, you can see a subtle dusky discoloration around the infant's lips. We call that perioral cyanosis. And here's another picture where it's a little more distinct. Now you can see this in some infants if they're just crying really hard. Sometimes you can see it in toddlers, especially if they're breath holders. But that's a conversation for another day. Anyway, as a general rule, if you see any one of these happening for 10 seconds, that might not be a crisis. But it's a whole picture, how all of these pieces of data fit together and how they're changing over time that we want you to monitor. The next thing we want you to follow is their hydration status. Kids, because their bodies are smaller, they have less total body water to redistribute if their intake goes down. So one way we track their hydration is by watching their urine output. In the hospital, we might track this by weighing their diapers or putting a urine collection hat in the toilet for older children. But at home, we usually just want you to keep track of how often they're peeing, even if their diapers feel lighter than usual. However, we do know that when people, including kids, are sick, their bodies release a hormone that makes them excrete less fluid. In other words, they produce less urine, which is protective against dehydration. For infants and some toddlers, you can also watch for drooling or tears, which can give you information about whether or not they're dehydrated. That's a fluid loss that their body cut off if they're starting to get a little dry. Another factor that can really affect hydration is fever status. If your child develops a fever, that can be really scary for some people, but it's not actually dangerous and it may be beneficial. But one true downside of fever is that they can speed up fluid losses, make children more prone to dehydration. They do this by increasing your respiratory rate, the number of breaths you take per minute, but also obviously through sweating when their temperature is coming back down. For infants under 12 months, for every increased degree centigrade, we would expect their respiratory rate to increase by 10 breaths per minute. For children over 12 months, for each degree, their respiratory rate should go up 5 breaths per minute. How do you calculate respiratory rate? Well, usually you can watch their chest, or you can also put your hand on their chest and feel the movement, and get a watch or a clock and count breaths for 6 seconds, and then multiply by 10. Or actually even better, count breaths for the entire 60 seconds. That will give you the most accurate count because none of us takes breaths at exactly the same rate. We speed up and we slow down, and the longer you count, the less error you're gonna get. All right, so you've counted a respiratory rate. What number are you looking for? For infants, we would expect their respiratory rate to be under 60 breaths per minute. For toddlers, 1 to 3 years, under 40 breaths per minute. For preschoolers, 3 to 5 years, we would expect it to be under 35 breaths per minute. And for school-age kids, under 30 breaths per minute. So if you're concerned about your child, having these numbers when you speak with their doctor can sometimes be helpful. What can you do if you're concerned about dehydration? Depending on the age of the child and how dehydrated they are, you can encourage them to drink some water or Pedialyte. If they're still breastfeeding, that can be a great way to keep babies hydrated. If they're willing to breastfeed, definitely do that over Pedialyte. If your infant or toddler is just refusing to drink, you could try using a medication dosing syringe to give them a teaspoon or 5 milliliters of fluid at a time, just into their cheek. You would just have to do this more or less often depending on how big your child is. If they're an average height infant, you might only need to do this 1 teaspoon every 10 to 20 minutes. If they're an average height toddler, they might need a teaspoon every 5 to 10 minutes. An older kid might need a teaspoon every 2 to 5 minutes. And I know you're thinking, oh my God, a teaspoon every 2 minutes. That seems like a lot of work. But you don't have to do this 24 hours a day. You can do this to help them catch up a little bit or just limp by with these strategies for a short period of time. Regardless, you can see that they really don't need that much fluid to stay hydrated. And these calculations may even be a little on the high side, depending on how active your child is when they're sick. If they're eating or drinking anything at all, you can probably revise down the amount that they need. This is really just if they're refusing to eat or drink anything. But like I said before, this is just another piece of the puzzle. If you feel like your child is happy and playful and acting like their normal self, then that's reassuring. But if you're feeling like they're a little off, or if you notice one or more of these signs that we just talked about, and they seem to be gradually increasing over hours or days, then that might be a reason to call your doctor. Because especially now, it's fairly likely that they'll be able to just schedule a telemedicine appointment with you and take a look at your child and tell you, actually, your child looks good, and here's why. Or here's why I'm concerned. And then they can give you instructions for where to go or what to do next. So now that you know what to look for, how do you keep everybody else in the house safe? So the first thing to do is to choose a caregiver. If you're in a household with more than one adult, now is the time to pick one person to be with the child. And as much as possible, the rest of the family should try to stay in separate airspaces. Even if you're in a two-parent household with only one child, you should still do this, because as inconvenient as it is, you're going to want to keep at least one adult healthy if you can. Also, if it's possible, try to designate a different bathroom for the infected child. Consider only changing diapers in the bathroom to make sure that you can wash your hands immediately afterwards without having to touch doorknobs or anything. If your child is older than 2 years, have them wear a mask anytime they're outside of their room or around the rest of the family if that can't be avoided. Also, once a day, try to open the window in the child's room for a few minutes to allow the air to exchange, because the longer the child breathes out in that space, the more the air in there is going to accumulate virus over time. And every time the door to the rest of the house opens, those virus particles are going to float out into the rest of the house. So if you can do an air exchange once a day, you can at least decrease the viral load in that room, and thus the viral load that's spreading into the rest of the house. Okay, so now you know how to monitor your child and what you can do to protect the rest of the family. What can you do to keep everyone in the household as healthy as possible right now? So there are a lot of different supplements that people tell me they're taking or giving their kids to try to boost their immune system, and the large majority of them aren't supported by much or any good quality evidence. And some of them are kind of dangerous. There are some interventions that have been shown to be beneficial, both in general and for the specific virus. And if we know how the immune system works, we can use that knowledge to target the branches of the immune system that we want to optimize and when we want to optimize them. So the first thing that probably everyone should be doing right now is to start vitamin D supplementation. And this has actually been studied specifically with the SARS CoV-2 virus. The SHADE study done in India looked at its effect on increased viral clearance and decreased inflammatory markers, both of which are prognostic indicators for improvement. So the SHADE study had people take 50,000 international units per day for 7 days, and then decrease them down to 4,000 international units per day after that. Maybe don't do that. But it is very safe, at least as far as fat-soluble vitamins go. Adults who haven't been tested can safely take up to 4,000 international units per day. If you get tested and find out that you're low, then you may need quite a bit more than that. And your doctor will probably write you a prescription for a high-dose supplement to be taken on a specific schedule. We usually have infants taking 400 international units per day and children taking 1,000 international units. There's another study done in Spain that took high-risk hospitalized patients and found that high-dose vitamin D supplementation decreased the need for ICU admission from 50% down to 2%. For such a safe intervention that you can buy at the grocery store, there's little reason not to do this. Also, if you live north of the 35th parallel, the sunlight hits us at a much more shallow angle. It's less direct, and so it's less strong, and it's less likely to lead to vitamin D production on our skin, even if we get plenty of sun exposure. So because of this, a lot of us up here would probably benefit from taking more than the doses I mentioned earlier. If you're not sure what dose you or your child should be taking, talk to your doctor and they can give you guidance based on your location and your relative level of melanin deficiency. Another supplement that may be helpful is zinc, which doesn't have as explicit evidence for SARS CoV-2, but it does have data for similar viruses. So we know that zinc is required to activate T lymphocytes. Probably because of this, zinc deficiency has been shown to worsen outcomes. So if you're deficient, then taking a supplement will improve your immune system response. However, if you're not deficient, then we don't have evidence that zinc supplementation will be beneficial. If your family has a really healthy diet, your kid eats minimal processed food, may not benefit from this. But if you have a chicken nuggets and french fries kid, then zinc supplementation might be something to consider. We also know that sleep, especially the early hours before midnight, is beneficial for boosting your innate immune system. One supplement that may be beneficial for both sleep and your immune system is melatonin. It not only helps some people get to sleep, but it also functions as an antioxidant, which helps to decrease inflammation, which makes your immune system work better. The next two aren't supplements, and in order to understand them, you need to know a little bit about how your immune system works. Whoa, okay, so your immune system's complicated. So maybe we'll simplify it a little bit. Okay, maybe we'll simplify it a lot. Okay, I think we can work with this one. So there are two halves of your immune system. There's the innate system, which is the first line of defense. It works immediately on infections using cellular and physical and chemical strategies. And it starts as soon as you get exposed to a new microbe. And it's the strongest when you're a child and gets weaker with age. There's the adaptive immune system. This is the second line of defense. It responds more slowly by producing and releasing antibodies that are specific to the microbe, always saving a copy of whatever antibody they make in case you get exposed to that microbe again. And this process takes 1 to 2 weeks after exposure, and because it's continuously building this library of antibodies over time, it gets more powerful as you get older, as you get exposed to more things. When you're first exposed to SARS CoV-2, it's the innate immune system that manages the infection, and that's the wing of the immune system that determines if you're going to be someone who has a mild course or someone who needs to be hospitalized. The stronger your innate immune system is, the less likely you are to progress to have severe disease. So how do we ramp up the innate immune system? Now, one surprising way is through cold exposure. So bringing your core body temperature down for a brief period of time can increase your body's circulating natural killer cells. So playing out in the snow and allowing your core body temperature to drop a bit while you're out there can potentially improve your body's ability to fight infection. Another probably less surprising strategy is to increase your core body temperature. Okay, so there's a lot of fever phobia out there, but fever is functional. Your body creates fevers for a reason. It helps your immune system to work better, it makes enzymatic reactions happen faster, it just adds energy to the system. And it does this naturally in response to an infection or to a challenge to your immune system. Your brain raises your body temperature by turning up the thermostat inside your hypothalamus, which is the part of your brain that regulates your body temperature. And when this happens, just like when you turn up the thermostat in your house, the furnace comes on because it's colder in your house than the thermostat says it should be. And then your heaters work to try to increase the temperature in your house until it matches the thermostat. The same thing happens when your brain turns up the thermostat in your hypothalamus. You start to feel cold because your current body temperature is lower than the new set point. And so your body starts to use strategies to try to increase your temperature up to the new higher set point. You might get chills and shiver, you might wrap up in a blanket. These are signs that someone is developing a fever and they're working to increase their body temperature to its new higher set point. Fever is an adaptive response that we see all throughout the animal kingdom. If your dog gets sick, they might get a fever, or your cat. Birds mount a fever response, even leeches. So this is a response that was developed way back in our evolution before our ancestors split off from the leech. It was a long time ago. And this response has been conserved in each new version of us since then. And that really suggests that it's serving an important purpose. If it wasn't, we would have eliminated it from the gene pool a long time ago, because it's a response that takes a lot of energy. And it takes a lot of energy when you're sick and probably not foraging for food or going to a water source. Your body is using its precious resources to mount a fever at a time when it's not getting any resources coming in. So that alone should tell you how vital the fever response is for our immune system when it comes to fighting off infection. So we know fever is important if we develop it naturally. And because of that, not suppressing it with acetaminophen or ibuprofen, if you're tolerating it, can be really helpful. But if you're not sick enough for your body to produce a fever, or you're just trying to prevent infection, increasing your body temperature to simulate a fever can also be helpful. And we've actually known about the benefit of hyperthermia for centuries. There's a multitude of studies that show that increasing your body temperature improves the function of your immune system. One specific study that showed that putting people in water baths, hot tubs, at a range of temperatures would gradually increase their interferon levels. And interferon is a major player in your innate immune system. Specifically, getting to 39 degrees centigrade increased those levels tenfold. And we've known this for years, since the 1920s, when a psychiatrist first noticed that his neurosyphilis patients, when they got sick and had a fever, their syphilis went away. And this was in the age before antibiotics. So if you got syphilis, that was it. You just had syphilis. So he did this totally brilliant thing. He gave these patients malaria so that they would have cyclic fevers, which cleared their neurosyphilis. And once they were improved, he used the treatments they had available at the time to treat their malaria. And this guy got the Nobel Prize for this back in the 1920s. So we've known about the benefits of fever and hyperthermia for a really long time. Basically what we're saying is, if you have COVID in the first week or two after exposure, you're basically required to take a long hot bath. Doctor's orders. Okay, so how do you know if you're hot enough? Well, we want you to get to 39 degrees centigrade and stay there for about 10 to 20 minutes. So you could obviously use a thermometer if you have one. Actually, if you don't have one, this might be a good time to get one. And actually, you probably have two. if you have kids. One that's easy to use. Don't get the ear thermometers, they're terrible. But one surface temperature device that gives you an easy rapid read, and a second thermometer, a rectal thermometer for kids 3 years and under, or a regular digital stick thermometer that you can use either oral or axillary just to check the information you got from the first one. So you can check your temperature with a thermometer, or you can just make sure that the bath is hot enough that you're sweating. If your forehead is sweating, your body is trying to cool itself down because you've warmed it above its natural set point. So if you're sweating, you're probably hot enough. So the last thing is, when can you finally leave the house? This is a little complicated, so let's talk about it with an example. Let's say you have COVID and you get tested on the first of the month and you're positive. You're wondering, when can your child go back to school? So you isolate at home, you stay away from your family as much as possible for the prescribed amount of time, and let's say you're asymptomatic, just to keep it simple. You stay away from everyone for 10 days after you were swabbed and came back positive. Your child has to quarantine as well, but for how long? So depending on who you ask, there are a few different ways to do this math. And I know that sounds ridiculous, but the guidelines just aren't entirely clear on what to do if the exposure is coming from inside the house. So throughout the time that you're in isolation, that you're isolating, you're presumably trying not to transmit the virus to your kids or anyone else in the house. Maybe you do a terrible job and they get exposed on day one, but maybe some of the things you do actually help and your child isn't exposed to the virus at all during the 10-day period. It's hard to know. Because of that, the safest thing to do would be to start counting their quarantine on the 10th, after you finish your isolation, because maybe they weren't exposed until the last day. Then, if your child is asymptomatic, they can go on day 15 to get tested and to get results by day 17, and they can return on that day. This is because the CDC relaxed the quarantine guidelines, suggesting that if someone is exposed and asymptomatic, they can be tested on day 5, and presumably to get results by day 7, and they can be cleared to be out of quarantine by day 7. Wow, that was a real marathon. So I guess it's time to go put everybody in a hot bath and order some vitamins on the internet. No, I'm just kidding. No. But if you've made it this far, you're either my mom, hi mom, or maybe this was helpful for you in some way. I guess either way, remember that the best way to take care of your kids is to take care of yourself.